Welcome to the Prognosis for Healthcare Reform in 2022 virtual event. I'm Tina Reed, healthcare editor at Axios, and I'm coming to you today from Arlington, Virginia. Welcome to our audiences on Facebook, YouTube, Twitter, LinkedIn, and on Axios.com. You can join the conversation today on Twitter with @Axios and #Axios Events. Over the next 30 minutes, I will be joined by my colleague Caitlin Owens, and we will dive deep on the legislation and initiatives aimed at improving healthcare access and affordability in 2022. Our first guest is the Senator from Delaware, Senator Tom Carper, joining us from Washington, D.C. Welcome, Senator Carper.
Thank you. Good to be with you. Thank you.
So I wanted to start with the major news of the week during our discussion today, which is obviously the leaked decision from the Supreme Court that indicates it will overturn Roe versus Wade. And I wanted to just get your initial reactions about that and what the implications will be.
I've had the privilege of serving as Delaware's treasurer, congressman, governor, and senator, and of all the issues that I've dealt with over the years, one of the toughest ones, just to be honest with you, is the issue of a woman's right to choose. Should there be limits? Should there be no limits? And I think at the end of the day, what we're discussing here, what we're debating here and wrestling with here again is whether a woman is going to have the right in this country to make her own health care decision, including whether she is going to carry a pregnancy to full term. These are intensely personal decisions. I think the decisions that are driven in no small part by a person's religious views. And but at the end of the day, I always try to put myself in the shoes of other people, older when I make a decision. I think about the 12-year-old girl in Michigan that I heard about today who might be made pregnant by rape and not be able to obtain an abortion. And we don't want to see such young women or any women in a situation like that.
And yet you haven't always been necessarily somebody who's voted along party lines when it comes to this particular issue. I'm thinking back to voting against the so-called partial birth abortion ban. Can you talk about or contrast, back in 2003 with that vote and what was going on at that time with what we see going on now?
It's funny. I thought you were going to go to a different vote that's been raised many times. And the vote that's oftentimes raised is, why did I vote in favor of cloture? That is to allow us to go forward and actually vote whether or not to confirm Justice Alito. And I voted for cloture, which means basically to close debate and just to move on and vote up or down on his confirmation. I chose to vote for cloture. I thought his nomination deserved a vote, something that Merrick Garland never got after being nominated by Barack Obama in his administration. So I did not vote for Alito, and I was concerned in large part whether or not he felt that Roe versus Wade was set alight of the laws. It's something that's already been decided and shouldn't be reopened. It's clearly he and a number of the other recently confirmed Supreme Court justices who said in the run-up to their confirmation votes, I think almost to a person, that they believe this was settled law and didn't indicate that they favored turning it on its head. And now it looks like they may well be prepared to do just that.
Do you expect that there will be a vote to eliminate the filibuster to pass abortion protections, and would you support that at this time?
It's I think it's too early to say. We began yesterday, actually, the debate in our caucus about that very issue. And in the past have been reluctant to go down that road. I think there's some exceptions to that. And this might be one of those. We'll just hold open on that, but I think I'd be a lean in that direction.
Well, I'd like to shift to some other issues that obviously are really pressing when it comes to looking at healthcare. The administration's obviously been raising alarms regarding getting new COVID funding. Supposedly, there's bipartisan agreement on getting COVID funding. Can the Democrats disentangle this funding from this fight over Title 42 and get this tranche of money out? Do you expect it will go out with the Ukraine aid? I'd love to hear your thoughts on how this moves forward.
Let me try to dumb it down so that people like me can understand it. We're in a situation with Ukraine. We need to provide them all the help that they can use and need. And that includes a supplemental that's been asked for, requested by the press, a supplemental appropriation. If we don't, on the second point, if we don't provide additional funding, supplemental appropriation for COVID, we'll live to regret it. They talk about a foolish decision. We know that we're going to have other variations of this virus. Will come back and haunt us just like it has in the last 2 years. It'll happen again, and we need to be ready, right on the money, ready to go, and go after it and help fund the research that needs to be done, so we can come up with the vaccinations and the booster shots and the other kind of therapeutics to kill it right in its cradle. So we need to do both. And the question of whether or not, I think it's very a tangled web when we talk about Title 42, Title 8 or 10. At the end of the day, we're a general nation of immigrants. But having said that, we need to have secure borders, and we need to be welcoming to the stranger for people who are desperate and need help and they deserving of our help. And if they were to go through the right process to be admitted to this country and become eventually have a chance to work toward citizenship, I think we need to be welcoming to them.
Well, do you think that it can be, do you think we can get a clean vote on COVID funding to actually get it to move ahead then? Or we talk about how entangled it is.
This gets a little bit convoluted, but I think we ought to have a chance to vote up or down, putting together a package that says, one, we're going to be provide additional aid for the folks in the Ukraine, military and otherwise. Two, we're going to make sure that we're ready with funding all the research that needs to be done. We're ready to go if we get another COVID attack, a different kind of variant. And I think there should be a third vote on whether or not the so-called Title 40 is going to be waived, or we're going to stick with what's been our guiding principles for years, which is called Title 8. And I think at the end of the day, if we're as Democrats, we ought to be smart enough to figure out how to craft an approach that would serve as an alternative to 42, and be true to the principles of, if you will, biblical admonition, the biblical in Matthew 25 to welcome the stranger.
Everyone is expecting Build Back Better to come back with perhaps a different name. What healthcare elements do you believe are most realistic to come back with it?
My staff and I worked with a number of Democrats and Republicans on pharmaceutical pricing. I think that's one that we ought to deal with and can and should deal with. We're fortunate to have a lot of pharmaceutical companies in this country and around the world who do good work and come up with vaccinations for variants, medicines to stop once we're sick with these particular COVID diseases. But having said that, a couple of things we need to do let me just say like this. I ask there's certain questions that I ask whenever I'm asked about changes in pharmaceutical pricing. One of those is, does whatever proposals being proffered, does it still provide for encouragement and incentive for innovation? And number two, does it save any money for the federal government? Number three, does it save money for patients? And those are the kind of questions that I ask. And so we actually debated and I think supported with our caucus almost unanimously legislation that answers all those questions in the affirmative. And I think that's a course we should follow. It also has a benefit of cruising about $250 billion that can be used for a variety of other programs, including child care, including early childhood education, workforce training, and so forth. And also, there's I think the other deal is the insulin. I think insulin's been around for 100 years. and people are being asked to pay hundreds and hundreds of dollars for doses of insulin. Cost is about $35. That's outrageous. I think we ought to protect individuals, seniors who are on Medicare, from having to pay more than $2,000 a year out of their own pockets. And so those are some of the things that I believe there should be. There's certainly strong Democratic support for, and I would hope bipartisan support.
Could you dig in a little bit more, though, on specifics about what you think needs to happen with drug pricing to get it under control in this country? Like, can you talk about, like, should we have direct negotiations for a dozen drugs, 200 drugs? Should we have international reference pricing, inflation caps? Like, can you talk a little bit more about how can we actually realistically do this?
Yeah, I like to say, find out what works, do more of that. I'm a veteran. I'm the last Vietnam veteran serving in the U.S. Senate. We have a policy in the VA where the secretary of the VA has the opportunity to create a formulary of many drugs and to negotiate price with the manufacturers of those drugs. And what we've proposed in the package I was describing earlier would be a similar approach where the Secretary of Health and Human Services would be authorized to negotiate, particularly on drugs that for which there's no alternative. Put the Secretary in a position to negotiate not on all pharmaceuticals, but on start with a handful and increase in the years after that. Sort of using what they've done in the VA for years as an example to follow that. Again, find what works, do more of that. It works for the VA, it works for veterans, and I think a similar approach is worthy of considering and pursuing.
Well, Senator Tom Carper, thank you very much for joining Axios today.
Thank you very much. It's good to see you. Take care. Be safe.
And next, we have a view from the top with Axios co-founder and president, Roy Schwartz.
Thanks, Tina, and thank you to our sponsor, Pharma, for making this conversation possible. Now joining us from Washington, D.C. is Chief Operating Officer, Lori Riley. Lori, welcome. Thank you.
Thank you, Roy.
Let's jump in. Spending on private coverage and out-of-pocket costs seems to be increasing, and the rising cost of care in the U.S. presents a real affordability issue for many Americans. What could be done differently?
Well, you're exactly right, Roy. I think, coming out of 2+ years now of being in the midst of COVID, I think the one thing that has become clear to all of us is just how important a stable healthcare system is for so many patients. And when you look at surveys in terms of what concerns people the most, it tends to be out-of-pocket costs that are not covered by your insurance. So things like deductibles and co-pays that patients have to pay in order to actually access the healthcare that they have. We recently did a patient experience survey, and we found out that about 1/3 of Americans find that their current healthcare costs are just simply unworkable for their budget. Which isn't really surprising when you look at other data that shows that less than half of Americans have $1,000 that's accessible if they have a healthcare emergency. As it relates to medicines, which is what pharma focuses on, people have seen a dramatic increase in their out-of-pocket costs. Over the past decade or so, more and more Americans now have pretty high deductibles. These are costs that have to be met year after year after year before they actually feel like they have insurance. And once they get through the deductible phase, they then face high cost sharing for their medicines, often a percentage of the price of the medicine. So for patients that take brand medicines that now have a deductible, they've seen their out-of-pocket costs go up 50% in under 10 years. And despite the fact that the net price, or the price the manufacturer of the medicine actually receives, has been relatively stable over the last few years, and in other words, not increasing, and in some instances actually decreasing, patients aren't feeling it. Those cost savings aren't getting adequately passed on to patients, so they're struggling. They're struggling to afford access to the care that they, in many instances, desperately need.
Yeah, our existing system seems to have many gaps, especially for the sick and the vulnerable. What are you seeing, and how do you think we can solve these problems?
That's a great question. I think, unfortunately, many Americans feel a bit hopeless when they think about our healthcare system. And part of it is due to cost, as I talked about a moment ago. And then part of it is due to other barriers that get in the way of patients being able to access the care that they need. I mentioned before a patient experience survey that we recently did, and what we found is half of patients who take brand name medicines face an insurance barrier to getting access to their medicine. So that might be things like prior authorization, where the physician has to seek authorization from the insurance company before they can get the medicine. Or they may have to fail first on a number of other medicines before they can get access to the medicine their doctor wants them to have. Unfortunately, about 65% of people that are subjected to some form of utilization management have said their health has suffered as a result of having to jump through these various hoops. And another, unfortunate, troubling spot is the fact that many of these practices are leading to greater inequities in our healthcare system. Again, COVID demonstrated that we do have inequities as it relates to care in our system. And these practices are just another example of inequities in our system. So, for example, about 2/3 of Hispanic Americans and over half of Black Americans who use medicines have reported that they have insurance barriers compared to about 40% of white Americans. So the bottom line here is that the system today is creating these inequities, creating unfairness, and it's hurting those that are most vulnerable, who quite honestly need the care the very most.
And what are some reforms that would solve these issues?
Great question. I think depending on the type of insurance an individual has, there are different types of solutions. So for the Medicare population, those individuals 65 and over, we think an out-of-pocket maximum, having some certainty that on a yearly basis, a senior will have to spend no more than a certain amount of money. And after that, those costs would be covered. We'd love to see lower cost sharing for seniors as well, and predictability in terms of how much they're going to have to spend on a monthly basis. Most seniors live on a limited budget. They want to know on a month-to-month basis, what is that amount going to be? And is there a way to make that more predictable? Now, for people that have commercial insurance, those that are employed like you and I, there are other things that I think could be done to make the system better. One is first dollar coverage for different types of medicines. When people have chronic conditions, asthma, diabetics, heart disease, they often have to take a medicine every single month. And unfortunately, the way the system works today, they often have to get through several $1,000s in deductibles before they feel like they have insurance. For many of those conditions, we think it's important that they have coverage from day one. Again, cost sharing is an issue, so anything we can do to lower the cost that they pay when they show up at the pharmacy counter. Of course, predictability, not that dissimilar from the Medicare population. Many Americans live on fixed and limited incomes, and having predictability about what someone is going to spend every month is really, really important to so many. And then to the extent that these many people rely on financial assistance, often from pharmaceutical manufacturers, we want to make sure that those resources count towards patients actually fulfilling their deductible. What we don't want, and I think what patients don't want, are oftentimes the type of policies that we hear talked about that unfortunately have unintended consequences. One of those we hear a lot about is letting Medicare, quote, negotiate for the price of medicines. What these policies actually do is not negotiate. Negotiation happens today, but rather they allow the government to set the price for a given medicine. And what that leads to is less innovation in the future and limits on access that many Americans rely on today. When you actually tell people some of the trade-offs that are inherent in ideas like that, support for those types of positions fall to less than 10%. So patients want solutions that lower their costs. They want solutions that address barriers to care that exist and the inequities in our system, but they also want solutions that preserve future innovation. So many Americans are relying and hoping that our industry is able to find solutions that address some of the issues that plague us and the conditions that plague us, much like we did with COVID, but we have a long way to go. We want to be part of the solution. Our industry has said clearly we're willing to do our fair share, but the reforms need to look at the system as a whole and not just myopically at our industry.
Well, Lori, thank you so much for joining us today. And next, over to my colleague, Caitlin Owens.
I'm Caitlin Owens, a healthcare reporter here at Axios. Our final guest today is the Ford Professor of Economics at the Massachusetts Institute of Technology, Dr. Jonathan Gruber, joining us from Lexington, Massachusetts. Welcome, John.
Great to be here.
So let's just start with a little bit of a scene setter. Where we are right now is health care reform was part of the Build Back Better package, which is all but dead as of right now in the Senate. We're seeing some signs of life in the past couple of weeks. But if you're just kind of looking at the tea leaves, and specifically with regard to the healthcare components of this legislative package, what's your sense of where things stand?
Well, there seems to be broad-based support for doing these really necessary expansions to the Affordable Care Act. If you remember the history, President Obama, to his credit economically, insisted that the Affordable Care Act be budget neutral, actually budget reducing. At the time it was passed, the CBO projected the ACA would lower the budget by $1 trillion over the next decade. What that meant was that the subsidies available under the exchange were not as generous as many would have liked. And I think it was recognized during the pandemic that lack of generosity was keeping people from using exchanges when they really could benefit. And therefore, the subsidies were expanded. They were made available to more people. They were made more affordable. And I think people realized that was a positive step. Several million more people gained health insurance coverage, leading us one step further towards universal coverage in this country. And I think there's widespread agreement that would be a real step backwards to let that end.
Well, let's just talk about the politics of the ACA subsidies for a moment. As you said, that during the pandemic, Democrats passed enhanced ACA subsidies. If they don't extend them, it seems very likely that some of these exchange enrollees will get notices right before the midterms that their premiums are going up or they're not getting any assistance anymore at all. How much do you think kind of the political fear of that happening will play into what happens on the Hill?
Yeah, I think the political fear per se of a certain number of enrollees getting those notices is probably not as large as the general fear that, what does this mean for really addressing healthcare affordability in our country? That the Democratic Party can't get 50 votes together to do this necessary expansion, make healthcare affordable in our nation, is worrisome. They're not counting on Republican support, although Republicans should support this as well. But if the Democrats can't get 50 votes together for this, it's sort of worrisome. The ACA was a political compromise. It's not the first choice of many, particularly those on the very progressive left. But it was a huge step forward. And it was really the Trump administration really sort of cut back in the Affordable Care Act, made it less effective. And Biden, to his credit, has come in full steam ahead in making the Affordable Care Act move towards what it really could be, towards really realizing its potential. And I think there'd be very large foreign political consequences for those of us who believe that single payer isn't really politically feasible right now. And that if we want to expand health insurance coverage, we need to do so incrementally. I think this is a real blow to that cause if we can't do this kind of incremental reform that is so obviously necessary.
Well, an expansion of Medicare benefits. I think we landed on vision at the final iteration of the package. That seems to be dead, and that was kind of even a whittled down compromise from vision, hearing, and dental. Do you feel the same way about if any expansion of Medicare gets nixed from the package as well?
Well, I think, you really have to draw a line between changes that are fundamentally going to be viewed as an attack by the private insurance industry and those that are not. The private insurance industry, for better or worse, for those who lived through the Clinton healthcare reforms, we still bear the scars of the hiring of these ads. And we know the private insurance industry, if they go to war, can make a difference politically on both sides of the aisle. I think the types of expansions that were in Build Back Better, that were in the American Rescue Plan, and that Build Back Better were proposed to expand, are not fundamentally sort of viewed, I think, as an attack by the insurance industry. I think expanding Medicare benefits is, and I think that is a harder political lift. I'm not opposed to it, but I think it's a harder political lift. And honestly, I would hate to see millions of people lose health insurance coverage in a fight over that expansion. I think getting people health insurance coverage is more important, and I think that's doable. It's more politically feasible, and we should just get it done.
And what about prescription drug pricing reform? Obviously, that was a part of the Build Back Better package, and that actually, I mean, who knows what Joe Manchin wants, but that seems like something he is in favor of. So what do you think the prospects of some kind of prescription drug reform getting across the finish line are?
Look, it's such a no-brainer to efficient drug reform and used to pay for coverage for the uninsured. I mean, what could possibly be better than to limit the unaffordable prices of drugs in America needs to cover people with health insurance? I mean, how could you not design a better policy than that? Politically, pharma is right up there with the insurance companies. It's a pretty powerful lobby. It's been a tough battle. It's been certainly whittled down enormously from what was proposed in HR 3, which was about 250 drugs being regulated, now down to 5 or 7. But even, I think, a step in that direction would be terrific, even if it's a modest one. If it raises some money and says that the federal government recognizes that, look, the market for prescription drugs is broken. I'm an economist. I believe in free markets, where the conditions for free markets allow them to thrive. That's not true in prescription drugs. The market failed, and we need some kind of regulation on prescription drug pricing. But politically, we seem to be stuck in this bind. They talk about the Manchinima dilemma, where Senator Sinema seems very, very opposed to doing significant work on prescription drug pricing, but she's open to things like expanding the child tax credit and maybe even increasing the deficit. Senator Manchin seems much more open on prescription drug pricing, which is great, but less open on expanding the deficit, I think, for the child tax credit. I think, once again, I hope that both of them can realize and get behind the expansion of the ACA that we need, as well as things like the child tax credit, which I support. But it seems like if we look at the set of things people seem to agree on, it seems like climate change and the ACA expansion seem 1 and 2 on that list. The question is just how we pay for it. And the question is, can we get that sweet spot where Senator Sinema is willing to live with some prescription pricing reform, which we need desperately, and Senator Manchin is maybe willing to live with a package that might be a little bigger than he likes.
And can you talk a little bit about the consequences of not doing health reform this year? And we've touched some on the politics, if you want to talk more about that, but also just from a patient perspective.
Caitlin, it's devastating to human lives. We now have a number of incredibly well done, peer-reviewed articles showing that health insurance expansions under the ACA saved lives. Tens of thousands of lives were saved every year by these expansions. The fact that we would have brought 3 million more people into the health insurance coverage and that we then kick them back out, risking their lives, risking their financial security, it's just not befitting our country of our wealth level, of our means and resources. We have the ability to cover these people with health insurance. Not to mention, of course, the ongoing tragedy of the lack of Medicaid expansion. I just came back from a music festival in Georgia, and Georgia still has not expanded its Medicaid program, along with Florida and Texas, states with many uninsured people, many needy people, where the federal government is offering to pay them to expand Medicaid. And I think the citizens of those states, they rallied to elect Democratic senators in Georgia. They need to rally to get Medicaid expanded, because this is just political malpractice that these states are not expanding Medicaid. In Build Back Better was an attempt to try to address that, to try to bring states into the subsidy regime. If they hadn't expanded Medicaid, I think that's great. That could make a huge difference. But once again, it would just be a tragedy in terms of human lives, in terms of financial security, and in terms of our ability as a Democratic Party to advance healthcare reform if we can't get this done.
So we have about a minute left, and I'm going to change gears a little bit here. Related subject, but different. COVID funding. That's obviously a huge fight in Washington right now. Democrats say that there needs to be more COVID funding allocated by Congress. But you're also seeing grumblings that, federal funding of treatments, vaccines, testing, it can't go on forever. So what do you think would happen if basically COVID tools went to the private sector? Is that a good thing, a bad thing? What would that look like?
Well, I mean, we only have 30 seconds, so I recommend people look at the Brookings blog that I put together with Richard Frank and Matthew Fiedler, Arena Conti, and Susan Apey, where we discuss these issues. But the private sector will not provide enough vaccine. We know that. We know that in many contexts, it's just on the financial interest of drug companies to provide these. There should be ongoing, continuous, what we call both push incentives for vaccines, which is funding of R&D, and pull incentives, which is guaranteed purchase. And they should be free. Now, COVID treatments, that's a tougher issue. It's not entirely clear to me why we want ongoing free COVID, for example, ongoing free diabetes treatment or AIDS treatment or other things. So that one's a little harder. But vaccination is a no-brainer. We need ongoing federal support for vaccination and ongoing free vaccination to keep our country safe from this and future pandemics.
Well, we are out of time, but John, thank you so much for joining us today in this insightful conversation.
My pleasure. Thanks for having me.
Thank you all for joining this afternoon for another virtual conversation that has made everyone smarter, faster. For more information or to sign up for Axios' Vitals newsletter, you can visit axios.com/newsletters or the Axios app. Thank you all for joining. We'll see you on axios.com.